Hi and welcome. Starting therapy for your young child is an important first step, and we're here to walk you through what to expect in therapy. Therapy for young children looks a little different from what you might imagine. Instead of a traditional talk therapy for your child, we use what's called child-centered play therapy, or we use child-focused methods like TBRI or trust-based relational intervention. With young kids, play is their natural language. It's how they express themselves and their emotions. It's how they make sense of the world around them. So while it may look like we're just playing, your child is actually building trust, learning new skills, and practicing how to communicate their emotions. So through play, children explore and share what they're feeling in ways that feel safe and natural to them. In therapy, this play helps them to practice important skills like recognizing and talking about their feelings, managing their frustrations, and learning how to connect with others. As their parent through this process, you're a vital part of it. You spend far more time than we do with your child, and we only see them for about 50 minutes a week, but you're with them every day. That's why we'll often ask for your support with activities to practice at home. We might give you some homework, and that's so that the progress in therapy really takes hold. We also might ask for some parent-only sessions for you to join in or for you to join in with your child. And that's where the therapist is trying to help you understand some of the skills that your child is building and how you can support them to make the most of the therapy process. You're the most important relationship in your child's life, so working closely with you is really essential for your child's growth. If you ever have any questions or you feel unsure about anything through the therapy process, really hope that you reach out. Sometimes, you might have questions and you're afraid to ask, but there's several ways to connect with your child's therapist. You can always request a parent session, just like an extra appointment for you, either by phone or in person. You could also ask for some check-ins with your therapist at the beginning or the end of your child's appointment. Just be aware that that may cut into some of their therapy time. And then we also have parent input forms that you can fill out before or after your child's appointment. You'll just need to ask your therapist to send that through our client portal. If you're not sure how to access any of this, just let your therapist know. Email is a great way to do that. So now let's go over some of the stages of counseling as you go through this so that you know what to expect as we go along. The very first appointment for your child is called the intake, and that at this age is for parents only. This session helps us understand your child's needs and helps us to set the goals for therapy. So we need to know why we're here. It also gives space to talk through any tough topics that you might want to share without your child present. Then after the intake, we move into what's called active treatment, which is where we work consistently on the goals that we've set together. For progress to really take hold, we recommend weekly sessions. The regular schedule helps your child to build on the new skills that they're learning each week and gives them that regular cadence of processing if that's part of their goals. The length of this active stage really varies. It often lasts between 2 and 12 months, depending on your child's needs. During this time, your involvement is really valuable. By supporting skills at home, you're helping your child strengthen them in real life. Once your child has met their goals, we transfer to a more supportive or maintenance stage, where sessions gradually become less frequent, maybe every other week and even once a month. This stage is all about helping your child hold on to their progress and keep building on the skills that they've learned. Think of it as building like muscle memory. It takes regular practice to create new habits and behaviors. So during this time, there might be changes that happen in your child's life, or maybe they revert back a little bit, and we might increase sessions temporarily if something new comes up. But usually we just stay at that supportive stage for several months. Remember, we're here to support your child every step of the way. If you ever have questions, don't hesitate to reach out to us. Thank you so much for allowing us to be part of your journey. Together, we're building a strong foundation for your child's future.